Thanks so much for joining us today for today's Healthy 100 web chat. I'm Jennifer Roberts. Today we're going to be taking on a topic that a lot of people can relate to. It's IBS and frustrating digestive health issues. We've got a great doctor in today to talk you through about what you can do to prevent these issues and manage some of them, especially IBS. We've got Dr. Miriam Kashi. She's a gastroenterologist here at Florida Hospital. She's going to be here for the next 20 minutes or so to take your questions. We'd love for you to type those in. Start getting to those as soon as we can. We'll try and get to as many as we can over the next 20 minutes. And I have a few questions of my own that we're going to get started with. But the doctor is in, so let's get this chat started. Welcome to Dr. Kashi. Thank you so much for joining us.
Thank you so much for having me.
Fantastic. Let's talk a little bit about IBS. What is IBS?
Well, some people call it a disease, but it's more of a syndrome. It's a combination of symptoms with abdominal pain associated with bowel habit changes. Some patients have a predominance of constipation. Some patients have a predominance of diarrhea, and some patients are mixed. And but most importantly, what characterizes and what combines these patients together is the fact that abdominal pain is associated with a change in bowel habit.
Mm-hmm. And so it actually stands for Irritable Bowel Syndrome. Is that right?
Yes, it does.
Okay, and everybody likes to call it IBS because that sounds nicer,
It's
right?
much easier, yes.
It's much easier to say. It's nice. And a lot of this stuff is not fun to talk about, but it really is a big problem for a lot of people, I'm sure.
It is. It actually is probably the most commonly diagnosed GI condition overall. Mm-hmm. It affects about 15% of of patients in North America, but only about 15% actually come and seek care for it. But still, it's that if you count of how many people we actually have in North America, it's still a substantial number of patients who are affected and seeking care.
Yeah, and you talked about it not being a disease. Are there other digestive health problems that are not actually diseases that we kind of call that?
Well, there are lots of things that are not necessarily diseases. Gilbert syndrome, for example, is a benign condition that has bilirubin that's elevated persistently, and it's not associated. It's not a disease. It's just a condition. It's benign completely, and we don't do anything for it, and we don't really need to have any follow-up for it. Mm-hmm. So we just consider that more of a syndrome.
Yeah. Let's go back to the IBS, because I know a lot of people may have some of the symptoms and may not realize that they may be experiencing something. So let's talk about what causes IBS.
Well, we really don't know what causes it in most patients, but we've noticed that over the past several years that a lot of patients who have some sort of a gastrointestinal event, so whether it's viral or bacterial gastroenteritis, they may end up with irritable bowel syndrome as a prolonged syndrome afterwards. And so these patients end up with the same sort of symptoms as the patients who are idiopathic or unknown causes of it.
Mm-hmm. And so how do you go about diagnosing IBS?
Well, a diagnosis can be tricky because it's more of a clinical diagnosis. The important thing about the diagnosis is to make sure that your patients don't have an organic cause of disease. So by that we mean we want to make sure that they don't have Crohn's disease, for example, or ulcerative colitis. If our patients are diarrhea predominant, we want to make sure that they don't have celiac disease or maybe an infection that's brewing. So depending on the patient, there may be a certain number of things that we need to rule out, for example. Mm-hmm. So one of those would be microscopic colitis as a possible cause of diarrhea, infections including parasites and things like that, which some patients get really concerned about, especially ones who've been traveling to exotic places. And for constipation patients, depending on whether there's blood in their stool or if you've had any changes in your weight, or depending on their age, then you may need to do colon cancer screening. You may need to evaluate a little bit further.
Mm-hmm, mm-hmm. And are there a certain population that are more predominant to get IBS or have those type of symptoms? And is there a certain stage in life for that?
Well, interestingly, IBS affects everyone. You see it in children, you see it in the elderly, you see it in men and women. Predominantly, there seems to be a predominance seen in women. a 2 to 1 actually compared to men.
Really?
So that's, but it affects everyone.
Yeah. Yeah. And so do women, and I know a lot of times people will pass off symptoms as, oh, I ate something, or, how do people know if they're in that range of I ate something or did something that was not really good for me, but at the same time, or it may be something more? Is it just how often things occur? Or?
Yes, I think that's a very good way of putting it. I think that a lot of patients, you and I have had episodes where we've eaten out and haven't felt well, or we've even had some loose stools for a couple of days. And of course, there's so many viruses going around. This past season, we had lots of patients with gastroenteritis. Yes, and some of our patients were only for a couple of days, and other patients lasted over 3 weeks.
Wow.
So, but it's important for the diagnosis of irritable bowel syndrome. You want to make sure that these are symptoms that you're having long term. It's not just an acute or short term event, but these symptoms seem to be persisting. They don't have to be every day. Some of our patients have symptoms that only a couple of times a week or a couple of times a month, but it's cyclical. And it seems to be recurrent, even though it can be intermittent.
We want to get to one of our first questions from the web, and I wanted to see what you thought about this one. Does stress cause IBS?
Yes.
Yeah, talk about that.
It doesn't cause IBS.
Okay.
We have to be careful, I guess, the way we word it. But it does exacerbate the symptoms significantly. A lot of our patients will be fine. They'll be perfectly functional, but oh my goodness, if I have that test coming up, I'm going to get either horrible constipation or horrible diarrhea, depending on which one gets exacerbated for them. So our patients are a little bit different, but they have some background things that are very similar. They don't always have to be diarrhea or constipation, but the triggers are often very similar.
Do you advise them on ways to manage that stress? Does that bring any relief for some of these patients?
Yes, it does. I think that one of the most important things is to, one, recognize it, that this is affecting your bowels and your gut. And then that's very helpful to patients, because sometimes patients get scared when they have this recurrent abdominal pain. And if it's irritable bowel syndrome and they say, oh, well, I just had a stressful event and now I'm having recurrent symptoms, that improves things. And instead of it becoming a vicious cycle, because now they're more worried and more stressed because they have abdominal pain. So that's helpful. Also, sometimes we refer them to a psychologist for behavior modification. Some of our patients don't like to be on medications for long periods of time, and so that seems to be helpful. I usually really like to use that for our young patients in their 20s and late teens who you don't want to keep them on medications for a long period of time. And so behavior modification has really helped a lot of our patients in that way.
Yeah. Another question that we're getting, talking about hot drinks like tea or coffee. Should those things be avoided if IBS is suspected?
That's a very good question. And I think it depends on your symptoms. If you have more diarrhea predominant, then the caffeine in those drinks would definitely exacerbate the diarrhea. And so in those patients, that may be something they might want to avoid.
Good thing to think about. Talk about IBS as a precursor to things like Crohn's and colitis and some of those types of diseases. How do they all fit together?
Well, they're not exactly the same type of diseases. Crohn's disease and ulcerative colitis fall into a category of inflammatory bowel disease. And that's a disease, a true disease. And the basic problem is inflammatory. And irritable bowel syndrome, there is no inflammation. It's a clinical diagnosis based on a symptomatology, but you can't biopsy it. There's no lab test for it. There's no CAT scan that you can do to show irritable bowel syndrome. But that's very different from irritable inflammatory bowel disease.
Got it.
But a lot of our patients with inflammatory bowel disease do seem to have underlying IBS as a concomitant problem, and so we see a lot of crossover.
Okay.
But IBS, irritable bowel syndrome, does not turn into inflammatory bowel disease.
Yeah. Everybody wants to know about diet, and you were talking about some of those lifestyle changes. What can you do with your diet with any of these type of diseases or syndromes?
Well, one of the first things that we say is avoid lactose, avoid dairy products. we see a lot of crossover with our irritable bowel syndrome patients, and especially the diarrhea predominant ones. And if they are also lactose intolerant, that may exacerbate their symptoms and may stimulate the cramping and diarrhea. Actually, I have some patients who have constipation associated with that as well. And so one thing we can do is we can do a breath hydrogen test to evaluate for lactose intolerance.
Really?
We can also do small bowel biopsies if you're going to get an upper endoscopy anyway. But you can just do a trial of dairy avoidance.
Yeah.
You could do that for 2 weeks and see if your symptoms improve.
Right.
Other things that affect our diet, affect these are sometimes food allergies. The data on that is not very good, to be honest with you. But some of our patients, just anecdotally, have improved with just getting a food allergy panel and seeing what things seem to be positive, and avoidance of those foods seems to have helped a few of our patients. But that's just anecdotal, and there is no data to, the data is still unsupportive of a general recommendation for it. Other things that may affect your diet are gluten. And so we see a lot of our patients,
right
yes,
now.
it's a very hot topic. And even if you do not have true celiac disease, you may have gluten intolerance. And so some of our patients by the time they come to me, have already given themselves a trial of gluten-free. It's a very hard diet to do.
Yeah.
And it's not something that you can do in part, because it doesn't really work.
Yeah,
So
it's got to be all or nothing.
It's an all or nothing, yeah. So you have to be either really good about it and just see if that helps you. And other things, one other diet thing that we can do is following a FODMAP diet. These are avoidance of many carbohydrates that can cause certain symptoms associated with irritable bowel syndrome. And following this diet does is it takes out lots of these carbohydrates that could be troublesome, and then slowly allows you to reintroduce them one by one and to see which foods exactly cause your symptoms. And that can be really helpful to patients.
Great. A couple more questions that we're getting from viewers. Are Imodium or Pepto good for IBS? Because I know people lots to go to the over-the-counter medications when there's something going on with the tummy.
Yes, absolutely. And I don't really mind people taking those at all. I think those are perfectly fine. But I usually like to be sure that what we're treating is irritable bowel syndrome. If we are sure that you don't have inflammatory bowel disease and you don't have an infection, then those things are probably okay to use intermittently.
But it's not going to be a long-term treatment.
It can be an intermittent treatment.
Intermittent.
You can use it as needed, but again, the important thing is to make sure that we're not missing the diagnosis of something other than just irritable bowel syndrome. That's really important.
Yeah. Another question from a viewer: how long should you wait before you see a doctor? You've got these symptoms.
Some of our patients have had these symptoms for many years. Most of our patients have had them for many, many years before they come to see us. But occasionally we have patients who have only been troubled by them by several weeks or months. And most of these patients are alarmed by them because it's new and it's sudden, and it's a certain change in their bowel habit and their regularity. And so they seek care more, I guess, earlier than others. The patients that I always think that should be seeking care very early are the ones with alarm symptoms. Patients who have had anemia, weight loss, a change in bowel habit is always very important. What else? Bleeding. Bleeding. Those are very, very important. So if you have any of these type of alarm symptoms, then it's important to seek care no matter what your condition is, whether it's irritable bowel syndrome or otherwise.
Is there a length of time that you would recommend that people would kind of wait out the symptoms and see if this is a temporary thing before going into the doctor?
Yes, I do, because right now, especially with the bug going around with gastroenteritis, viral or infectious, I think that it's important to just wait out your symptoms, maybe about 2-3 weeks. If they're persistent, then you might want to be checked and might want to make sure that you don't have an infection that's really going to continue.
Yeah. Okay. Sounds good. Let's talk a little bit about flare-ups and what is best to eat. So we were talking about some of the foods that can help you manage, but we've heard a lot about how healthy foods, things like whole grains, raw fruits and vegetables, can actually make a flare-up worse. Is that true? Do you experience that? And if so, what would you advise people to eat to manage those times when things are flaring up a little bit?
I think that our foods always affect our GI tract, whether you're allergic to something or just intolerant to it. And yes, those FODMAPs that we mentioned earlier are very healthy foods. They're broccoli and cauliflower and asparagus and all kinds of good things. But it's not to say that everyone is going to be affected by them. So it's very individual. So your therapy and your diet has to be very individualized. And so we can't designate one list of foods to avoid for all IBS patients.
Right. Mm-hmm.
That's why the FODMAP diet is so important. You take out everything, pretty much you starve everyone for just a little bit. And so you slowly introduce these foods, and then you realize which ones affect each particular patient.
Mm-hmm. Sounds like a lot of how when you first start feeding young children,
You
you
do.
start
It's
with nothing and then you introduce things very slowly.
Yes,
It's very
absolutely.
similar. Yeah,
It's very
yeah.
wise.
Talk a little bit about probiotics and how probiotics, what they are and how they factor into the whole IBS picture. And I would love to know, for me personally, do probiotics, are they good for people that don't have some of these issues?
Well, probiotics have become a multi-billion-dollar industry.
Yeah.
And you see patients taking it for all kinds of random things, and patients taking it for absolutely nothing. They're
Yeah.
perfectly healthy. They have no other issues. But I think that in medicine, it's important to follow evidence-based. And so if you have ulcerative colitis, if you have a C. diff infection of the colon, if you have pouchitis, and even irritable bowel syndrome, then I think that there is good data to support probiotics in these settings. But outside of these, even ulcerative colitis, there's good data. Outside of these settings, I don't really recommend them for the general public. I don't really think there's a reason for it. There are enough nutrients in your diet. If you have a proper diet,
Yeah.
Then you should be obtaining all your nutrients and your normal gut flora that has been brewing for hundreds of years, and the way your body has developed for hundreds of years is really sufficient. Mm-hmm. And so in irritable bowel syndrome, there's good data for various strains of lactobacillus and bifidobacter. Bifidobacter infantis actually has some good data, and the manufacturer's name is Align. And a lot of our patients find some relief, our irritable bowel patients find some relief with those. And it doesn't help everyone, and it can be kind of pricey.
Yeah.
They add up.
I've noticed.
Yes, they get a little bit expensive. But some patients are convinced that they are going to gain some sort of benefit, and so they continue taking them. But I generally feel that if you find some benefit, and you think it's doing something for you, great. If not, then you don't need it for general health.
Yeah. Okay. Fantastic. Another question coming in from the viewers: can you develop IBS if you don't have a gallbladder? I haven't thought about that.
Well, it's not related.
Not related. Okay.
No, it's not related to the gallbladder. It's more of an intestinal type of discomfort and issue.
Mm-hmm. Okay. Talk a little bit about exercise and IBS, and is there any links to, physical health in that way?
Yes, exercise is actually very important in helping deal with the symptoms of irritable bowel syndrome. Mm-hmm. Our patients who exercise regularly, 30 minutes a day, 3 to 4 times a week, have significant improvement. A lot of our patients who have cramping and bloating symptoms are significantly improved with exercise.
So it's literally the physical movement that is improving the situation, and not the general benefits of exercise that we normally talk about.
Yes,
that's really helping
exactly.
these patients.
It's movement of the gut.
Yeah.
Because when you exercise, the gut wakes up and it's stimulated and begins to move. And so that's particularly helpful for our constipation patients and our bloated patients.
Yeah. Is there anything in particular exercise-wise that you would recommend if someone maybe isn't doing an exercise routine?
If they're not doing anything, we always start off with a walking routine. Just general swift walking, 30 minutes a day, 3 to 4 times a week would be wonderful.
Would be a great start. Okay.
Aerobic, but mainly.
Yeah, aerobic exercise. Okay. And then we talked a little bit about, how long you should wait to see medical attention for some of these issues. Is that generally true with all GI issues?
Yes.
Okay.
Yes.
So the 2 weeks, if we're still having issues.
2 to 3 weeks, I would say. But with all GI issues, difficulty swallowing, weight loss, anemia, change in bowel habit, blood anywhere, black stools. Black stools are really very important because they're a sign of bleeding as well, and we don't often talk about that in the general public. And I think that those are really important. So if you have those signs are considered alarm signs, and you should not wait.
Yeah. We want to take one more question as we kind of wrap up the chat here. We've talked a little bit about this, and I know you've alluded to it, but I don't think we've directly asked this question. Is IBS always diarrhea? And I know you've talked a little bit about it includes constipation. So maybe go over those symptoms again for IBS really quick as we wrap things up.
Sure. IBS is mainly abdominal discomfort associated with change in bowel habit, and that change can be diarrhea, constipation, or both, alternating back and forth. And that's the crux of it. Every patient is a little bit different in how long they spend with their diarrhea or their constipation.
Okay.
They can have normal bowel habits in between even.
Wow. Okay. Good to know. Thanks so much to Dr. Kashi for her expertise on digestive health today. And of course, to learn more about managing digestive health and to learn about some of our experts here at Florida Hospital, you can visit Florida Hospital digestive.com and get some information there. If you'd like to schedule an appointment with Dr. Kashi, you can do that 2 different ways. The first is via phone. Do that at 407-303-DOCS, or you can go online at centralfloridagi.com. You can get information there on how to make an appointment with Dr. Kashi. And of course, you can also find out more about upcoming web chats that we're going to have here on Florida Hospital and on our Facebook page. Also, you can follow us on Twitter. So if you go like us on Facebook, follow us on Twitter, you'll get all the information you need regarding upcoming health chats. We'd love to have you back again. Thanks so much for watching and participating in our chat today. And of course, we'd love to see you back. Thanks.